Hi, this is Dr. A. In this medical terminology video, we are going to look at the diagnostic and therapeutic procedures for the eye. So first we're going to talk about eye examination tests. So we have color vision tests. They use multicolored charts to determine a patient's ability to recognize color. Fluorescein angiography is a process of injecting fluorescein dye to observe the movement of blood and detect lesions in the retina. Fluorescein staining is the application of bright green fluorescent eye drops to the cornea to look for abrasions or ulcers. A keratometer is an instrument used to measure the curvature of the cornea, and keratometry is a process of measuring the curvature of the cornea. This is an example of a colorblind test for red-green color blindness. In this picture, just in case you can't see it and you do have red-green color blindness, you should see a green W into a red circle and these are all dots, right? And then in this one, it's a green number 27 in a red circle. An ophthalmoscope is an instrument that is used to examine the inside of the eye. And ophthalmoscopy is the process of examining the interior of the eye using an ophthalmoscope. Optometer is an instrument that is used to measure how well the eye focuses images on the retina. Refractive error test is a vision test for a defect in the eye's ability to accurately focus an image. A slit lamp microscopy is a process of visually examining the conjunctiva, cornea, iris, and lens. And here's an example of the examination of the interior of the eye using an ophthalmoscope, a modern one. And then we have a Snellen chart. It's a chart used for testing distance vision. So this is very commonly seen in doctors' offices and other places. Tonometry is the measurement of intraocular pressure using a tonometer to check for glaucoma. Visual acuity test, it measures the sharpness of the patient's vision. So now some surgical procedures. Blepharectomy is a surgical removal of all or part of the eyelid. Blepharoplasty is a surgical repair of the eyelid. Conjunctivalplasty is a surgical repair of the conjunctiva. Cryopexy is the surgical fixation of the retina using extreme cold. Enucleation is the surgical removal of an eyeball. An intraocular lens implant is the use of an artificial lens to replace the lens that was removed during cataract surgery because the lens is too opaque from the cataract. An iridectomy is a surgical removal of a small portion of the iris. Iridosclerotomy is cutting into the iris and sclera. Keratoplasty is a surgical repair of the cornea. It is a term used when talking about corneal transplants. Laser-assisted in situ keratomiliosis, or LASIK surgery, is a correction of myopia, which is nearsightedness, using laser surgery to remove corneal tissue. And laser photocoagulation is the use of a laser to destroy very small, precise areas of the retina. Phacoemulsification is the use of high-frequency sound waves to liquefy a lens with a cataract, which is then removed with a needle, and then of course then you would put a surgical implant, lens implant. A photorefractive keratectomy is a surgical use of a laser to reshape the cornea and to correct errors of refraction. So remember, refraction is bending of light rays. Pneumatic retinopexy is a surgical injection of a glass bubble into the eye and positioning the head such as the bubble presses against an area of detached retina, and that's in the hopes of reattaching that retina. Radial keratotomy is making spot-like incisions around the cornea to flatten it. It is used to treat myopia. Retinopexy is the surgical fixation of the retina. Scleral buckling is placing a silicone band around the outside of the sclera to stabilize a detached retina. Sclerotomy is cutting into the sclera, and strabotomy is making an incision into the eye muscle to correct strabismus. Next, we have the pharmacology. So, an anesthetic ophthalmic solution are eye drops that are used to relieve pain associated with eye infections, corneal abrasions, or surgery, like Ocutane and Pontocaine. An antibiotic ophthalmic solution are eye drops that are used to treat a bacterial infection, like Delmycin and Iloticin. Anti-glaucoma medications reduce intraocular pressure by lowering the amount of aqueous humor, like Timoptic or Betamol. Artificial tears to treat dry eyes, like Aquatears or Refresh Plus. Miotic drops to constrict the pupil, like Eserine sulfate and Myostat. And mydriatic drops dilate the pupil, like Atropine Care, Atropizol, and ophthalmic. Atropizol, ophthalmic, together as one word, as two words, but one medication. And then lastly, we have ophthalmic decongestants, and they constrict the arterioles of the eye to reduce the redness and itching, like Visine and Murine. So, all right, that wraps up our diagnostics and treatments for the eye.